Hello everyone. So today I'm going to discuss another very important topic, which is cough. And cough is a lot of differential, and also there are very important things to ask in history. So whenever a patient presents to you with cough, the first thing that you need to ask is OD para. That is the onset, duration, intensity, progression, aggravating factor, relieving factor, and anything else. So in anything else, the first thing to ask is whether the cough is dry or productive. So you will ask the patient, do you have any phlegm? Okay, because sputum is a medical word. So you will ask, do you have any phlegm? Okay, and if they say yes, I do bring up some phlegm, then you will ask about the color and the quantity of the phlegm and if there is any blood in it. Okay. Also, you will ask about the timings of the cough, and other than that, you will ask about shortness of breath, chest pain, heart racing, leg swelling, to rule out other differentials. So the patient have cough and chest pain and heart racing, and there is leg swelling, so we will think about pulmonary embolism. However, it is rare for pulmonary embolism to present with cough, but you still have to exclude it, right? Also, you will ask about flaws to rule out lung cancer, which is the red flag here. So you will ask about fever, appetite loss, weight loss, and night sweats. Okay, and lumps and bumps in the body. So flaws will rule out lung cancer, and if the patient have fever and he has chest pain, shortness of breath, and cough, then you should also think of pneumonia as well. All right. So other than that, you will ask about history of, past history. Has this ever happened before? Any heart or lung condition? As this patient is presented with cough, so you will ask about any lung condition as well. So in maftosa, medications are very important because sometimes medications like ACE inhibitor can be the cause of cough. Asking about allergies is also very important because patients with asthma can have a lot of allergies and they can also present with cough. So asking about allergies is also important. Family history, so you should ask about family history of any lung disease or heart disease. Traveling here is also important because if the patient has been traveling to areas where TB is endemic, like South Asia or some parts of the Africa, then you should think about TB if the patient has recently traveled. Okay. All right. Psychosocial here is important. If it is chronic cough, then you should ask about how is it impacting your life. And also occupation is very important because you should ask about the occupation because it can be interstitial lung disease that can develop due to silica exposure, asbestos exposure, organic dust exposure. And if the patient has been working with asbestos, then it should also ring a bell in your mind that the patient can be probably having lung cancer. So occupation here is very, very important as well. Apart from that, in the lifestyle questions, cigarette smoking is important. So C stand for cigarette smoking. It's really important. You should ask a detailed history. So do you smoke? When did you start smoking? How many cigarettes do you smoke per day? Okay. Alcohol here is not so much important. Um, dietary habits, they are not important as well. Exercise, you just ask if it is triggered by exercise. But the history, the DX part, which stands for sexual history and the drug history, is important here. Why? Because if the patient is immunocompromised, if the patient is, for example, homeless and he is using IV drugs, so there is a high chance that this patient might be having HIV. And if this patient is having HIV, then there is a very high chance that this cough could be due to PCP. Okay, so this could be PCP pneumonia, which is pneumocystic carinae pneumonia. Okay, so you should ask about both IV drug abuse, because both IV drug abuse and sexual history, because HIV can be transferred to any of these routes. So you should ask about sexual history, IV drug use. You should ask if they exchange needles. If they say yes, I do use IV drugs, you should ask about any needle exchange with the partners, and do they know about needle exchange program? And if they don't know and they're sharing needles, then you should counsel them about needle exchange program in the management part. You should tell them that NHS has a needle exchange program. So even if you are using IV drugs, don't share needles, and you can take you can go to the clinic and they will give you new needles and you can use them, and after using you can go there and exchange them for free, and it will be safer for you. Because by sharing needles, there's a high risk that diseases that like HIV, hepatitis, another many serious infection can be transferred from one person to another. But that explanation you should do in the management part, not during history taking. You should in history taking you should just ask about IV drug use and needle sharing. After completing your history, you should verbalize any ideas, concerns, and expectations. I forgot to mention it here, but you should ask any idea what might be going on with you, any expectation from team today, anything in particular that you are concerned about, and then you should verbalize your examination, which will include vitals, and listen, and you will tell the patient that I will listen to a heart sound and lung sound if that's okay with you. All right, so the differentials, the major important differential here are pneumonia. So the patient will be presenting with fever, shortness of breath, and chest pain and cough. Okay. In TB, the patient will be presenting with low-grade fever for a long time. There will be a longer history of cough. There will be history of weight loss, night sweats, maybe blood in the sputum, and the patient will have a positive traveling history. Okay, so and maybe the patient have positive contact history. All right, so you should ask if anybody that is has been living with you, anybody in your close contacts that has been living with you or working with you is experiencing similar symptoms. Okay, and you should also ask about any travel to any TB endemic areas. All right. So PCP patient will be either he will have risk factors for HIV. So either he will be homeless and using IV drugs and sharing needles, or he will have a sexual history. He will be sexually positive, as sexually active, sorry, and he will not be using safe sex. Okay, so you need to ask that. So the PCP patient will have a lot of risk factor for HIV. He will have cough and he will have fever as well, low-grade fever, and he will have history of weight loss as well. But he will be very short of breath because in PCP patient oxygen saturation is really low, so this patient will be unstable. Okay, and lung cancer patients. So lung cancer patient will have either history of asbestos exposure, or smoking, or both. Okay, and they will have fever, appetite loss, weight loss, lumps and bumps in the body, and night sweats. Okay, so now let's discuss the management of each of these differentials one by one. So in TB cases, you should inform your seniors and you should request specific investigations that will include routine bloods like CBC, LFTs, RFTs, urea, and electrolyte. You should request a chest X-ray and you should also request a sputum culture for TB. Symptomatic treatment here will be paracetamol for the fever. A specific treatment here is TB medication course. So you will tell the patient that I will give you some medications that will work against the TB bacteria, but unfortunately you have to take them for 6 months. Okay, so for the first 2 months you will take 4 different medicines. They're basically 4 different medicines but combined in a single tablet, and for the next 4 months you will use 2 medicines. Okay, and if you get time you should also explain about the side effects that they sometimes cause the body secretions like urine and tears, and saliva to be a little bit oranges, but that is a normal effect and it is nothing to be worried about. But if you experience any numbness and tingling in the feet or dry tongue, then please come back to us. Okay, also advise about not going to work and school. Okay, so we will give sick note and tell them to cover their mouth while laughing, and ask them to not sleep in the same room as others because it will, and to sleep with the windows open. Okay, to minimize the spread of infection, because we need to tell them that TB is a contagious disease. Okay, one important step here is to inform public health authorities. So please don't forget about it. You should always inform public health authorities because TB is a notifiable disease. And what public health authorities will do, they will do contact tracing to see if anyone that the patient has been in close contact with has also got TB. Okay. Also, if the patient is homeless, then you should contact social services because social services will provide them some accommodation so that they don't go around spreading TB. And they will do something that is called as directly observed treatment, where they give TB medication daily to these patients under direct observation to ensure the treatment of the disease. Okay, follow-up should be at 2 weeks in case of TB. In PCP, as I already told you, that pneumocystic carotid pneumonia occurs in HIV patient, and these patients are quite unstable because in PCP pneumonia, the oxygen saturation is quite low. So you will have to admit these patients, okay? So tell them that we are going to admit you today, if that's okay with you. I'm going to inform my seniors. We are going to do some specific tests for you. These will include your routine blood test, your blood culture, your culture of your phlegm, chest X-ray, and arterial blood gases. The symptomatic treatment will be giving paracetamol for the fever. You will give oxygen because oxygen saturation is low. You will give fluids as well, and you will catheterize these patients to monitor urine output. Specific treatment here is IV antibiotics and IV steroids. Okay, so specific treatment here is two. Okay, remember that it's not only IV antibiotic, but it's IV steroids as well. At the end, you will also tell them that as this is a lung infection that is only common in people with low immunity, and one of the causes of low immunity is HIV. So we would like to test you for different causes of low immunity, including HIV, if that's okay with you. So you should also take consent for HIV testing in patients with PCP pneumonia, because PCP pneumonia always happen in HIV patients. Okay, a lung cancer. So in lung cancer, if the lung cancer patient presents in GP and you are suspecting that this patient has cancer. So there is a way to tell the patient, because this is quite a big news. So you should tell him like this: Mr. X, as you have been coughing for a while, for the past few months, 2 months or 3 months, whatever the patient tells you, and you will also experience some weight loss, some blood in the sputum. So I'm better worried about whether or not it's something serious. And with these symptoms, we are worried about some conditions, some serious conditions such as cancer. That's why I need to refer you to a hospital, to a chest specialist. Okay, so you have to name the specialist that a chest specialist is going to see you. Okay, you should tell them that I will make the referral today and you will receive an appointment by post within 2 weeks. What the specialist is going to do, you will tell them as well. You will tell them that he will do a scan of your chest, and they might need to take some tissue from the lungs to see under the microscope. As here, the management is only explaining the suspected diagnosis to them in a polite way, and telling them what the next step would be and what the specialist would be doing. There is no other management here, so please explain it thoroughly to them. And also try to go a bit, don't go like very fast, because it's quite a big news for the patient. So try to be more empathetic here. All right, safety netting. So you should safety net while they are waiting for a specialist appointment. You should safety net them for, massive hemoptysis or superior vena cava syndrome or stuff like that. So you should tell him that if you experience any shortness of breath, any chest pain, or if there is large amount of blood in your sputum, then please call 999 or visit the emergency department. Follow up will be after they are seen by the specialist. We will tell them that we will see you after you are seen by the specialist. Okay, what if you get a mass on the chest X-ray? They give you a chest X-ray and there's a mass on it. How are you going to explain that to a patient? Okay, so for example, you have this chest X-ray. So you will explain to the patient that, Mr. X, this is your chest X-ray, and this white shadow that you can see here is your heart, and these black shadows that you are seeing on the sides are your lungs. Normally, this area, the lung area, is completely black like this one. But as you can see on this side, there is this white shadow, which is not normal. Now, this could be a number of things. It can be an infection, and it can be a growth. Now, growths can be different things, and sometimes they can be, unfortunately, some serious things as well, like cancer. So we need to ascertain that nothing like that is going on. That's why I need to refer you to the specialist. They will do some further detailed scan, and they might need to take some tissue from this growth to see under a microscope to see what is going on inside your lungs. Okay, so this is the way that you should explain the chest X-ray to patient. So this was all about cough. Cough is quite an important station with a lot of differentials. There are some differentials I have explained in shortness of breath as well, because those differentials, they more commonly presents as shortness of breath, because shortness of breath is more pronounced there. And some differentials I explained with cough, because in these differential cough is more pronounced. So you should keep your mind really open, and because everything in the history is really important, starting from medications to allergies to family history, psychosocial, and then lifestyle questions. So I hope this was helpful, and I will see you with another video soon.